And there is renal vein, yes, and the most inferior and the most posterior it is ureter. So that's why this one is left kidney.
So
And-
you said which one of these surfaces anterior?
This anterior surface, yes.
And it's also
This is
Anterior lower convex.
this is anterior surface. What?
it's also
Look,
left, yes.
This one I don't know. What? This is anterior surface. Yes, this is anterior surface of the kidney. Posterior surface
so you
is
mean
flat.
this artery, it's anterior, a little medially, right? Or
The artery
It
is
is,
Anterior
it is in the
superior.
medial border. It starts from the medial border, but it is anteriorly, superiorly. Like here we can see, you see? This is abdominal. This is abdominal aorta. So this is no wait. This is not abdominal aorta. This is inferior vena cava. So this is wait, something is wrong. Wait, yes, this is right. Nothing is wrong. So for the kidney, for the right kidney,
Left kidney.
vein, yes, for the right kidney, vein is anteriorly, then artery, and then ureter. And if we are talking about the left kidney, then here we can see, you see, artery, renal artery is the most anterior, and then renal vein, and then ureter. So anyway, ureter is behind. This one is
Left.
yes, I think this one is also left because anterior surface is convex. Didn't you take another kidneys? And this one is right. Yes, because this is anterior surface. Yes, it is convex. This one is posterior surface. It is flat. Medial border that is concave. And so here we can see ureter. It is directed inferiorly and posteriorly. This one is ureter. So this one is right kidney.
Why is it right? I think it's also it's
No, ureter
it's
should
anterior.
go. Wait, let me see.
How can
It's
we
anterior.
differentiate between the top and
No, this is ureter. This ureter, it should go inferiorly. Yes, this is artery. This is renal artery. What did I say? It is left. Sorry.
Yes, left.
Right.
I
this is-
said
yes, right.
It's left, I think.
I want to say
Yes,
that
this is
this
left
more
also.
convex is
Yes,
on
right. This is left. Yes, this is also
full
left.
Fish
Last time we had another one. Right. So you didn't take it out.
left
لا
لا دي
في
right.
زي التانيين
Right,
right.
right. Right.
لو قلبتها تبقى ليفت ايوه كده
Right.
This is artery, and this is vein, and this is ureter, and this one is right.
Right.
Yes, this one is right. Yes. So vein, yes. For the right kidney, anteriorly vein, yes, and then artery, and then ureter, the most posterior. So this one is right. Yes,
So
this one is right.
you mean the position of the artery and vein it's different from the right to the left?
Yes.
it's how we will
العكس
distinguish them.
فوق.
It's in the right the ureter is
In both cases, ureter is the most posterior and inferiorly. The most posterior and inferior is ureter. Anyway, ureter is posteriorly. So just this is abdominal aorta, yes? Abdominal aorta is located to the left from inferior vena cava. So it gives renal artery. Here we can see it. And from the right, we can see inferior vena cava. This one. And so this one is renal vein. And renal artery is here. Like behind it, yes. Okay, let's skip it. About the topography. Right kidney is located below the left, like difference is about 1 vertebra. So right kidney is located from the first lumbar vertebra, is level from the first lumbar vertebra to the third lumbar vertebra. And left kidney is located between the 12th thoracic and second lumbar vertebra. And also superior poles of the kidneys, they are located closer to each other than inferior poles. Like the longitudinal axis of the kidney, it is not vertical. It is a little bit oblique. So they are located like this. In some cases, in cases of anomalies, yes, of development, even superior poles are not separated from each other, and such a condition is known as horseshoe kidney. When superior poles of the kidney they are fused with each other. Yes, horseshoe kidney. Так, окей. So,
So is there a reason that the left one is more higher or lower?
again, it is because of the liver. Liver is from the right side. That's why right kidney is located lower. Yes, and here there is not liver. That's why left kidney is located higher. No syncope, you will study it yourself. You have to know also fixation apparatus of the kidney. Like when we studied organs of abdominal cavity, we said that there are different ligaments, mesenteries, yes, for the small intestine, mesocolon for large intestine, which fix these organs to abdominal wall. And for the kidney, it is located retroperitoneally, so it's not the peritoneum that forms this fixation, but it is the other. These are the other structures. Like first, these are coverings of kidney. There are three coverings of kidney. The first one, it is fibrous capsule. This one is capsula fibrosa. The innermost one, we can even see it here. It is formed by connective tissue. Then outside of capsula fibrosa, there is adipose capsule, capsula adiposa. It also covers kidney from all the sides. It even enters renal hilum. So renal hilum, like porta hepatis, yes, it is a place in the kidney through which all the vessels, nerves, they enter, yes, and ureter also, yes, enter and leave from the kidney. So this adipose,
Ask there are three covers?
yes, there are three coverings. So adipose capsule is the second one. It is just fatty tissue. It is especially well developed on the posterior surface of the kidney, and here it even forms pararenal fat body or pararenal fat pad, corpus adiposum pararenale. So
Fat on the kidney?
yes, this is fat. All of this is fat.
Fatty tissue.
Yes, fatty tissue. So we can easily prove that this adipose capsule participates in fixation of the kidney, because when person loses weight suddenly, yes, very fast, then he can get nephroptosis. Ptosis means depression, yes, nephra means kidney. So depression of the kidney, because there is no more fat around the kidney, yes. And the third covering, the outermost, it is renal fascia. So renal fascia has two layers. Pre-renal, no, we cannot see it here, but pre-renal, that is in front of the kidney, and retrorenal, that is behind the kidney. So pre-renal fascia, it covers the anterior surface of each kidney, and then it goes medially, and it covers anteriorly renal artery, renal vein, inferior vena cava, aorta, yes, and goes to the anterior surface of the other kidney. It is pre-renal fascia. Then retrorenal fascia, it covers posterior surfaces of each kidney, and it joins medially to the lateral margins of lumbar vertebrae. So these two layers, pre-renal and retrorenal fascia, retrorenal layers, they join superiorly, and superiorly they also cover adrenal gland, yes, and then join also laterally. And inferiorly they do not join, because between them ureter passes. That's why, because they do not join inferiorly, here we can see ureter, that's it. Because they do not join inferiorly, that's why a kidney can be depressed. Yes? Yes. Так, okay. This is the first part, the first structures which accomplish fixation of the kidney. The second, it is renal pedicle. So renal pedicle, renal leg, yes, these are structures which enter and leave through the renal hilum. So they include renal artery, renal vein, and ureter also, yes?
That you said
Why?
like porta hepatis?
Да, like in porta hepatis. So why do they perform fixation of the kidney? Because even if kidney starts to move, yes, renal artery and renal vein, they have a definite length, yes, they cannot stretch much, because they start from, renal artery starts from abdominal aorta, for example, and kidney can depress only up to the length of renal artery, yes? Is that clear what am I saying? What? Okay. So that's why renal pedicle.
Right? This is dangerous, right?
What exactly? Nephraptosis?
Yes,
If
if
it
it
moves.
moves, that it will
Oh.
affect the
Yes,
artery.
yes, it can be flexure of urethra in this case. Like it can be flexed, and urine will not outflow anymore. Yes, it is dangerous. Okay, this is renal pedicle. The other it is muscular seat of kidney. So the muscles which form like a seat where kidney lies. Yes, there are 4 muscles. You have to revise them. The origin, insertion. Yes. So
Transverse abdomen.
superiorly it is lumbar part of the diaphragm. And so inferiorly it is quadratus lumborum muscle, here we can see it, and laterally it is transverse abdominis muscle, and also iliopsoas muscle. So 4 muscles, they form, so this is iliopsoas, sorry, and this is quadratus lumborum, yes, muscular seat of the kidney. So you have to revise the origin and insertion.
Okay.
And the fourth structure that also contributes to the fixation of kidney, it is intra-abdominal pressure. And intra-abdominal pressure, by which muscles is it provided?
Intra-abdominal muscle, it's
Pressure.
internal oblique abdominal muscle and the external oblique abdominal muscle and transverse abdomen. There is another.
And yes, there is one more.
لاتس dorsi.
No,
لا quadratus lumborum.
no.
مش فاهم.
على المصل بتاع الابدومين.
Muscles of the abdomen. It's
Muscle-
Yes.
abdomen.
Which?
internal oblique abdomen and external oblique abdomen
Arterius,
and
arterius.
لا
Arterius, arterius.
هي دي
Serratus anterior muscles.
internal oblique external oblique transverse abdomen
هي
ثلاثة.
الأخيرة
لا في تاني.
And which muscle forms anterior
abdomen.
group of muscles of the abdomen?
rectus.
Yes, and rectus abdominis also.
Rectus
Да.
abdominis.
So these muscles, they provide intra-abdominal pressure. If there is low intra-abdominal pressure, it also can cause movement of the kidney, yes, depression of the kidney. Okay, so about external structure, it's clear. About internal structure, so this is frontal section of the kidney, and so here we can see that parenchyma of the kidney is a parenchymous organ, yes, consists of 2 parts. So this is cortex, a peripheral part is cortex, and central part it is medulla. So here in the cortex we can see alternating lines, yes, very thin alternating lines. They are darker and lighter, darker and lighter. So lighter line is known as radiate part, pars radiata, and darker line it is convoluted part, pars convoluta. They have different color because different parts of nephron is a morphofunctional unit of kidney, so different parts of nephron are like present here. So here in the medulla we can see these triangular structures. They are renal pyramids. And these renal pyramids are separated from each other by means of renal colons. In renal colons vessels pass, like intralobar artery and veins pass. And here in the renal colons, in the renal pyramids, there are also parts of nephron. So you have to know that there is a renal lobe. A renal lobe, it is a renal pyramid surrounded by renal colons with adjacent part of cortex. This is one renal lobe. Like renal lobe includes one renal pyramid with parts of renal colons laterally from it and adjacent part of cortex. Yes, so this is renal lobe, this is another renal lobe, this is the third one. Yes, and there are also cortical lobules. They are about 600 in each kidney. Cortical lobules, it is radiate part that is surrounded by 2 convoluted parts. No, it's not visible here, but they are very small. These are cortical lobules. And medially, like in the very center, there is also pelvic-calyceal system of kidney. So here in the parenchyma of kidney, urine is produced. Here through the pelvic-calyceal system, urine is excreted. So it flows through this, yes? Each renal pyramid ends with renal papilla. So each renal papilla opens into the minor calyx. Minor calyx, yes. Calyx minor. So they are from 10 to 12 in each kidney. So this one, this is another one, this is one more. Here we also even can see what? This is, you see, renal papilla. This is renal papilla, yes? It opens into minor calyx. Okay, then 2 or 3 minor calyxes, they join and they form major calyx. This is major calyx. So there are 2 or 3 major calyxes in every kidney. and all the three major calyces, they join and they form renal pelvis. This is renal pelvis.
Which one?
This is, all of this is renal pelvis. And renal pelvis continues to the ureter. This is ureter. So about morphofunctional unit of kidney we will talk later. Okay, now ureter. So this is ureter, and this is also ureter. Here we can see it. Here it is. This is ureter. It is a hollow organ of urinary system, and its function is transport of urine from the kidney to the urinary bladder. Here we cannot see it because it is covered by peritoneum. Okay, so it is long.
Can we see it?
Here we can, yes. Here it is. This is ureter. This is ureter. Okay, so it is long. It starts at the level of the second lumbar vertebra. And it ends in the pelvic cavity, yes, in the fundus of urinary bladder, so that's it. Okay, so it has three parts. First, it is abdominal part. It is the longest part, and its inferior boundary is located at the level of terminal line. So what is terminal line? You will also please revise.
On
Yes.
the sacrum.
Yes.
Okay.
And then there is pelvic part that starts from the terminal line and ends in the urinary bladder, in the wall of urinary bladder. And then there is intramural part. Intramural part is in the wall of the urinary bladder. So this is also ureter. This is pelvic part, and then intramural part is in the wall of urinary bladder, and it ends with ureteric, what, here we can see it, ureteric opening, yes, internal opening of ureter, this one, and here is another one, 1 and 2, yes, of urinary bladder, because ureter is also paired organ.
So this all is urinary bladder? All of
No,
that?
just this urinary bladder, this is urinary bladder. Так, okay, so it is hollow organ, it has three parts, and it also forms three constrictions. So the first constriction is located at the very beginning, at the transition of renal pelvis to the ureter. So here there is the first constriction, and the second constriction is at the level of terminal line, and the third constriction is in the wall of urinary bladder. What is the significance of this constriction? That sometimes kidney stones are formed, yes? And these kidney stones, if they are not so big, like if they are small enough, they can enter ureter. But when they reach a place of constriction, then they will stuck, yes? And it will cause pain.
Yes.
Здрасте. Okay.
Need
Yes,
surgery,
it will
no?
cause pain, yes. No, it's not compulsory surgery. We can use spasmolytic special medicines which will dilate the lumen, yes. But if nothing helps, yes, then surgery will be required. So these constrictions are places of a possible obstruction, yes, where kidney stones can stuck, yes. Okay, then internal structure, it is hollow organ, as I told you. So in the wall of ureter there are 4 layers. It is mucosa, and mucosa is covered by a special type of epithelium, transitional epithelium. So at the next lesson you will tell me what is it, transitional epithelium. Then there is submucosa that forms folds, yes, and then there is muscular layer, and in the abdominal and in the pelvic part of the ureter there are 2 layers of muscles, internal is circular and external one is longitudinal, and in the wall of urinary bladder they become 3. Okay, there is also oblique. Okay, and about relation to the peritoneum, so ureter, like kidney, is located retroperitoneally, yes, just here peritoneum is removed by some students. What? So anteriorly it is covered by peritoneum, and from all the other sides it is covered by adventitia. Yes, right. Okay, then urinary bladder. This is urinary bladder. This is male urinary bladder. Urinary bladder or vesica urinaria,
What is the anatomical position of it?
like this.
Okay.
What? Vesica urinaria, it is in Latin, cystus in Greek. It is an organ of urinary system that performs storage of urine and excretion of urine. So it is located, empty urinary bladder is located completely in the pelvic cavity. Here it is, this is urinary bladder also, yes, completely, and here we can see it, this is urinary bladder, this is, yes, completely in the pelvic cavity, but if it is full, then it can reach even the level of the umbilicus. So syncope is different in males and females, yes. So for the males, behind the urinary bladder there is rectum. This is rectum. This is rectum. And here we even can see recta vesical pouch, yes, excavatio recta vesicalis. This is peritoneum, and from the posterior surface of urinary bladder it goes to anterior surface of rectum. Yes, also behind urinary bladder in males there are seminal vesicles, so we'll study them later. And below the urinary bladder there is prostate gland. This is prostate gland. And so in front of it there is pubic symphysis. It is in both males and females. So for the females, behind the urinary bladder there is uterus. Okay, so what about external structure? There is an apex of urinary bladder, apex, and then body. This is body, yes, then fundus, inferior part, and cervix. Cervix continues to the urethra. This is a prosthetic part of urethra, like beginning of urethra. So from the apex upward to the umbilicus, median umbilical fold goes, and inside this median umbilical fold there is urethus. Yes, we have already said about it. Okay. So now about internal structure. There is mucosa, as always, in any hollow organ, yes, and mucosa is covered by transitional epithelium. And under the mucosa there is submucosa, because you see there are very many folds in the urinary bladder, because after it gets full they become straight, yes. Okay, there is the only place in urinary bladder where there are no folds. It is vesical trigone, Olieta trigone. Here we can see it. So this trigone is bounded by internal urethral opening. It's here, and at the base there are two ureteric openings. So here you can see there are no folds, yes, because there is no submucosa here. Then outside of submucosa there is muscular layer. In the muscular membrane there are three layers: circular, longitudinal, and then oblique, I think, yes. I hope so. And so all of these muscles, not like in the intestines, yes, all of these muscular fibers, they contract together. And that's why, because they contract and urine is evacuated, yes? And that's why they form a single muscle that is known as detrusor urine muscle. Musculus detrusor urina. That muscle that pushes out the urine, yes, from the urinary bladder. And so from outside, empty urinary bladder is located retroperitoneally, so it is covered by peritoneum only from posterior side, and full urinary bladder is located mesoperitoneally. It is covered by peritoneum from three sides, from posterior and lateral sides, and anteriorly there is adventitia. So you also have to study adrenal gland, so you will study it yourself, I guess. You shouldn't study urethra. We will study urethra the next lesson when we study male reproductive system. Yes, so these are the organs which you are going to study for the next lesson. Now please take your morphofunctional unit of kidney. It is nephron. Nephron. So morphofunctional unit, you know, yes, it is the smallest part of the organ that can perform all of its functions. So nephron can perform all of the functions of the kidney. Process of urine formation includes three stages. So first it is filtration, then it is reabsorption, and the third stage it is secretion. structure. First part, it is Malpighian corpuscle or renal corpuscle. Malpighian corpuscle. So how is it formed? It consists of two parts. It is first of all Bowman's capsule. So Bowman's capsule looks like a cup, yes? So this is Bowman's capsule. Bowman's capsule. Actually, its complete name, it is Bowman-Shumlyansky capsule. Shumlyansky, because a great Russian scientist Shumlyansky invented it, discovered it, yes? But in English textbooks, it happens very often. Russian names are forgotten. I don't know why. So this is Bowman's capsule. And here to the Bowman's capsule, capillaries come. So efferent arteriole, this is efferent arteriole. That arteriole that brings blood. Efferent arteriole. It brings blood here, and when it reaches Bowman's capsule, it is divided into the capillaries, and these capillaries form glomerulus here. So this is glomerulus. Glomerulus. Kidney is a unique organ. It is the only organ in which capillaries again form arterial. So usually arterial forms capillaries, yes, and then capillaries join each other and they form venules. Yes, it's always so. Here in the kidney, arterioles again become larger and form another arterial, that is efferent arteriole. Efferent arteriole. Efferent arteriole. So such peculiarity, such a specific feature of the kidney, it is known as miraculous network of kidney. Miraculous, like miracle. Do you know miracle? Yes?
Yes.
Like in Latin it is rete mirabili. Miraculous network. Okay. So, but diameter of the efferent arteriole is much larger than diameter of efferent arteriole. So, larger amount of blood comes to the capillaries, and much smaller amount of blood can leave it at the same during the same period of time. Yes, such effect creates filtration pressure. Filtration pressure, and under the influence of this filtration pressure, some components of blood, they undergo filtration through the filtration membrane. So filtration membrane, it is here. Now we'll draw how it looks like. So again, we have capillaries, yes? And we know that wall of the capillary is formed by endotheliocytes, yes?
Yes.
Endotheliocytes. And they are located on the basement membrane. Basement membrane. And so from the other sides, there is Bowman's capsule. Bowman's capsule has two layers. This one is parietal layer of Bowman's capsule, and this one is visceral. We are interested in visceral layer. Visceral layer of Bowman's capsule is formed by special cells, podocytes. Podocytes.
Size is cells.
Site
Cells.
means cells. Right. Wow. Site means cells. All the cells, they end with sites. Yes. So these are podocytes. Podocytes. Yes. Poda means leg. So it's like a what is it? Like amoeba. Yes, has pseudopodia. Yes, they look like amoeba. Do you know amoeba? This unicellular.
Maybe, yes.
What? And so, yes, but podocytes have their own basement membrane. There is another, again, basement membrane for the podocytes. So, also basement membrane, another one. So, four components, yes, endothelial of capillaries, and their basement membrane, and basement membrane for podocytes and podocytes themselves, they form filtration membrane. This is filtration membrane. So through this filtration membrane, many components of blood can pass. So permeability of this layers is high. Yes, many components can pass, so they undergo filtration. And a result of filtration, it is formation of primary urine. So here in the Malpighian corpuscle, primary urine is formed. So result of filtration, it is formation of primary urine. And the amount of primary urine that is produced per day, so every day, it is 180 liters. So it's obviously that we don't have so many liters in our body, yes? It's because at the same time, reabsorption takes place in the other parts of nephron. So what does primary urine contain? It contains, like it's very close to plasma, yes? It's plasma, like you know, yes, that blood consists of plasma and form elements, yes? What are form elements?
Form elements. يعني ايه form elements؟ العناصر المكونة. عناصر.
No, this
Elements that form the. Elements that form
blood
the.
cells, yes. Which blood cells do you know?
Red blood cells, white blood cells.
And what else?
صفائح الدموية بس.
3.
صفائح الدموية but we didn't.
Again?
It's in Arabic صفائح دموية. We didn't know it in English.
Say it again.
صفائح دموية. صفائح دموية.
Yeah.
دموية it's meaning bloody. Blood.
Blood, دموية.
Yes. Dam, it's dam, just dam, it's a blood.
Dam means blood.
Yes.
Like blood sheets?
No, it's like platelet cells. There are erythrocytes or red blood cells, yes, leukocytes, white blood cells, and there are platelet cells or thrombocytes. So these cells cannot pass. So, but all the rest things, except large proteins, they pass, yes, and they form primary urine. So after that, this primary urine enters the system of tubules. So first it enters proximal convoluted tubules, proximal convoluted tubule. Yes, PCT. Then it, Then it enters Henle's loop. So like this is straight tubules and they form Henle's loop. And then distal convoluted tubule. So convoluted means like this, yes, convoluted. What? Or DCT, distal convoluted tubule. And then from distal convoluted tubule, it goes to collecting duct. To the collecting duct, actually many nephrons continue. Yes, many. So this is collecting duct. Collecting ducts. And at the renal papilla, yes. And from the renal papilla, it goes to the minor calyx.
Minor calyx.
Da. It's what we saw there.
Okay.
Minor calyx. Yes, and then major calyx and renal pelvis and then ureter. So here, reabsorption takes place in this system of tubules. So what is reabsorbed? Почему? Why is it reabsorbed? Yes, because efferent arterial, it goes here to these tubules and again forms capillaries. And here to these capillaries, reabsorption occurs. Reabsorption means And another absorption.
Yes.
Another absorption. Absorption means
Yes, yes, we know.
понятно, да?
We know.
Taking back. So reabsorption. What is reabsorbed? Water is reabsorbed. Yes? And some ions is reabsorbed, like natrium, chlorine is reabsorbed, glucose is reabsorbed. Yes? So in normal cases, glucose shouldn't be in the urine. Proteins are also reabsorbed. Proteins are reabsorbed. But some substances, they are also secreted. Like waste products are secreted here. Like what is secreted? Creatinine. Creatinine, for example. And urea is also secreted.
Uric acid.
Uric acid, yes, also. And so finally, to the collecting duct, secondary urine comes. Secondary urine comes. And its amount is 1.5 to 2 liters per day. 1.5 to 2 liters per day. And so this secondary urine is... Очень понятно, да? It's very clear. Вот. The secondary urine is excreted. Вот. Ну да. Вот. And now, if we draw such a line, yes, what like this, then we will see which structures of nephron are located in the cortex and which structures of nephron are located in the medulla. So, renal corpuscle, together with proximal and distal convoluted tubules, they are located in
Cortex.
the cortex,
Text.
yes, in the radiate and in the convoluted parts. And this Henle's loop and distal parts of collecting ducts, they are located in the medulla. That's how it is. No, it is for typical nephrons. Actually, there are cortical nephrons and there are medullary nephrons. No, like in typical nephrons, it is like that. Any questions?
Doctor,
Спасибо. Any questions? Just parts. No, just what main parts of the nephron. It will be again.
separated draw.
This is filtration membrane. Yes.
You should draw it like it's necessary.
No, it's not compulsory to draw. You just have to know it. You will have to draw this.